Dr. Musarat Riaz works at the Bakai Institute of Diabetology and Endocrinology, where they treat a lot of patients who come in with terrible complications in their feet as a result of diabetes.
Basically, a 65 years old patient, Mohammed Sadiq, he was a laborer, and he only became aware of his diabetes 1.5 to 2 years back, and when he developed a small lesion on his foot. When he came to us, his limb was already gangrenous and there was no way to save his limb. So what we did was we amputated his limb and tell him other things. But what happens in the meantime, when he was coming to the hospital daily, he was wearing tight shoes and he came in contact with the hot machinery in the taxi. That's why he get blisters in his other foot.
So in the long run, diabetes sort of eats up your body. If it damages the blood circulation to the nerves, you lose the ability to sense things properly. And this is lost first of all in the longest nerves, which are in the feet.
Nature has made you such that your pain is an essential tool for survival. That's how you and I perceive danger. Now in diabetics, they lose the sensation of pain in these peripheries. So a diabetic would be walking happily where you or I would be screaming in pain. With a small pebble in your shoe, you would not be able to walk beyond a few steps and you would stop and take the pebble out. But a diabetic won't feel it. He will keep walking and that pebble is going to cause an injury.
They are not feeling any pain, so they are least bothered about it.
The second thing that happens is, add to that our environment in our culture where closed shoes are still not the commonest way of footwear. Most people will be wearing an open sandal or slipper of some sort. That's the worst thing to have in a diabetic situation. So you have a 1, 2, 3 hit happening in a small environment.
So foot infections that lead to bone infections, that lead to gangrene, that lead to amputations, which is a disaster.
Now in Pakistan, we estimate that at present there will be around 400,000 people with diabetic foot problems. And if we take as a conservative estimate of the amputation rate, 40,000 of them would be needing some kind of operative procedures, which is a very high number again for a society which cannot afford.
In an effort to try to stop foot ulcers from getting worse, the team here has developed special shoes that aim to reduce the pressure on the foot.
Foot ulcer people, their key to management is that their ulcer shall not be weight bearing. Now these are again cost effective devices made locally.
For that purposes, specifically designed sandals are available in the market, but they are very expensive, $2,000–3,000 plus. Okay, but what we did is that seeing the same design, this is an ordinary slipper and this is a sole of an ordinary bata chappal, patti ki chappal. We take the above thing off and we put it on this sandal. Now according to the patient's lesion, wherever the patient's lesion, for example if it's here, there's a toe comes here, we'll make a hole and cut it out. Okay, and when the patient wears this shoe, that lesion will be offloaded. The pressure of the foot will not be on that portion. It has led to the decrease in the healing time and the quick recovery of the lesions.
So we have to have interventions and we have to have the community realize that early treatment of foot ulcer can prevent them from amputation.
So there are some individuals who do what is necessary to try and get their condition to as well controlled as possible. There are other individuals who go into denial.
There is this inertia which is probably nature's protective mechanism, otherwise people would go mad with uncertainty. An environment culturally or socially adapts to that situation for it to function. So I face this often enough that a patient comes with a bad situation and you ask them and it's been going on for more than 3 months, and then you probe and you realize that within the first few weeks someone advised that they need an amputation and the patient was not prepared for it. So he allowed it to get worse in the hope that that amputation won't happen, and because there isn't pain you can wait. So they would continue to harbor the problem and continue to hope that someone or the other will come up with a magical sort of a cure and fix it all, and they won't have to face the consequences which the initial person said.
After the break, we look at some magical cures which in theory claim to solve medical problems, but in practice often fail to cast a spell.